In this video, we'll figure out how many tests are needed in paired testing. In an earlier video, we figured out that for paired testing, there are 4 different possible cases. 2 people without the virus, or a first person with the virus and a second person without it, or a first person without the virus and a second person with the virus, or 2 people with the virus. Now we want to consider what happens in each case. Can you figure out what the first joint test would be? Positive or negative? Take a minute to think about it. First, we'll consider the case where neither of the 2 people have the virus. We will run a joint test and the result will be negative, no virus. If there's no virus in the joint sample, we can conclude that both people are negative. So for this pair, we only had to run 1 test. Now let's consider the case where the first person has the virus and the second person does not. The first joint test will come out positive. It will have evidence of the virus. But as testers, we wouldn't know whether it was the first person or the second person. So we're going to have to run another test. We'll run that test on person 1. And what happens? Well, the first person was the person with the virus. So that test is going to come out positive, showing the virus. Now, do we have to run another test? Well, we don't know if the second person has the virus or not. So we have to run another test on person 2. And in this case, it'll come out negative. So we ran 3 tests for this pair. We can also note that for the case above where neither had the virus, we only had to run 1 test. Now we'll consider the case where the first person does not have the virus, but the second person does. When we run the first joint test, it'll come out positive because there is evidence of the virus. So then we have to run our next test, and we'll run it on our first person. Now, person 1 was negative. They did not have the virus. So when we run our second test, the result will come out negative. What do you think we have to do next? It turns out that we don't have to run another test. The joint sample had been positive, but when we tested person 1, that came out negative. That means that the virus had to be coming from person 2. And we know that from just running 2 tests. In the final case, both people had the virus. So when we run the joint test, that will come out positive. We then run a test on person 1. That will come out positive. So do we have to run another test? Well, we don't know whether person 2 has the virus or not. So we still have to run a 3rd test on person 2. And this will come out positive. Overall, what we can see is that with pooled testing and testing pairs, sometimes we only had to run 1 test for a pair. But other times we had to run 2 or even 3 tests. So the question will be, when does pooled testing really make sense?